I want to just start actually out by making an observation, which is that there seems to be an argument here today, the Republican argument, that somehow we can't give middle-class tax cuts without also giving big tax breaks to billionaires. So I just want to be clear. I think I probably speak for everybody in my caucus that Democrats want lower taxes for middle-class, working-class people. We just don't think that the price for that should be giving, in this case, the top 0.1% of income earners $400,000 in tax breaks while we're taking health insurance away from 16 million Americans because of Medicaid and because of the Affordable Care Act changes and cutting nutrition support. So I just want to be clear about that. That is, the choice is not no tax breaks to middle-class Americans, because we're in support of that. But I want to ask you, Secretary Bessent, I want to follow up a bit on the questions that Senator Warren was asking. One of the features of the big, beautiful bill is significant, I would argue historic, cuts to Medicaid. You no doubt know that Medicaid is the largest health insurance payer in the United States. That's according to the American Hospital Association. It's the largest provider of mental health care coverage in this country. What percentage do you think is people on Medicaid that can work, do work? Do you have any thought? Do you know what that percentage is? I'm trying to...
Well, work requirements account for 8 million of the CBO's claim numbers, so they seem to think that 8 million people could come off. So
I'll tell you, this is data from the Kaiser Family Foundation in 2023. 92% of Medicaid adults under age 65 are working already. And so what is happening here is the big, beautiful bill is making it so much harder for people to get the health care that they deserve that they just give up. But I want to ask you what impact you think this is going to have on the economy. So you've got health insurance that is taken away from 16 million Americans. My question to you is what happens next? Because, you know, the data shows that when people lose their health insurance, uncompensated care goes up. That's the issue with rural hospitals. Medical debt goes up. People delay care and they ration their medications. People get sicker. So this has a direct impact on medical debt. Do you have an idea what the current medical debt is in the United States?
I do not, but I will tell you that I believe that that number you're giving is overstated by 5.1 million, and it's simply the Democrats' scheduled expiration of Obamacare subsidies, and you should have extended that when you were in control.
Okay, I'm not going to argue with you about whether it's, you know, how many multiple millions of Americans are going to lose their health insurance.
I like precision in numbers.
Well, I will believe in the precision of my numbers, okay, Secretary Bessent, but I can give you some precision about what the medical debt is in the United States. It is $220 billion. That is, again, according to the American Hospital Association. So let me ask you, how do you assess the impact of additional medical debt on American families, Minnesota families? What impact do you think that has? Because it seems to me to be pretty significant.
Well, Senator, we are trying to bend the curve on medical cost. And I believe that the medical expenses are out of control. We have seen
but you're not controlling medical expenses by taking insurance away from people. You're just shifting the cost to hospitals and individuals and uncompensated care.
We are trying to make sure that individuals who can work do, and we are trying to get the program back to the mothers and children it was meant for.
Mr. Secretary Bessent, the question I want to try to get you to hone in on is, you know, can you see that if we take insurance away from people, medical debt is going to go up, and that is bad for families, and it is bad for our economy because people are going to be burdened with additional debt.
It will be good for the economy for people to come back into the workforce.
But, Mr. Secretary, nearly everybody who can work, who is on Medicaid, does work. And in fact, we've seen, I have no doubt I won't get in the way of Senator Warnock, who I'm quite sure will want to talk about this as well because of the experience with Georgia. You're not saving money. You're just shifting cost to other places by taking health insurance away from people. Mr. Chair, I will close here and give back my 16 seconds.
Thank you, Senator Smith. And for the remaining senators who came after my last announcement, we are under a time pressure here, and so I've asked all senators to please stick rigidly to your 5 minutes. And next is Senator Lujan.